Namaste, I'm Dr. Siri, fertility expert with more than 15 years of experience practicing at Sai Karuna Fertility and Maternity Center, Nagarbavi, Bangalore. Postpartum period could be a really challenging time for any woman because there are a lot of changes, not just physically, mentally, and emotionally. A lot of hormonal changes that will be happening after delivery. So the hormonal changes that would have happened during pregnancy will take some time for it to come back to normal and feel normal postpartum. So generally the uterus would take about 4 to 6 weeks time to get back to its normal shape, and there are all other body hormones also which would have changed because of pregnancy. All of them more or less will take around 4 to 6 weeks time to kind of get back to a pre-pregnancy state. It is quite common to feel out of place post-delivery. One, because there's a lot of changes physically, as in part, the woman has had a cesarean section. Of course, there will be a lot of pain and discomfort in the lower abdomen. And if they've had a normal delivery, again there is a stitch which has been put for episiotomy, so that could be a little painful and troubling thing for the woman. And other than that, there is a sagging belly and the breasts are heavy because she is feeding the baby, and because of the hormonal changes you don't feel the same. There would be hair fall, there would be acne and hyperpigmentation, and hardly any time for rest and sleep, and hence it is very common to feel disconnected. And also mentally there is this new responsibility of taking care of your child, which you would any woman would prioritize over herself, which could cause this kind of disconnection or a lost feeling for any woman. So with time, with good family support and support from the partner, definitely you can be able to recover soon and get back to your normal life. So intimacy is not just physical, it is an emotional bonding too with the partner. So once after delivery, there are multiple things that are happening simultaneously when it concerns the physical and the mental levels. So most of the time there is a stitch either on the abdomen when there is a cesarean section, or there is an episiotomy stitch in the perineum, which could be painful so to have an intercourse. And also there is something called lochia that we say, a discharge or a bloody discharge that happens following a delivery, which could last somewhere between a week to even a month. So that could also be one of the factors to start an intimacy, physical intimacy. And there could be pain. So it is individualized basically between person to person as to when they are ready. But coming to the physical aspects, definitely it would take some time for the wound to heal, which is approximately 4 to 6 weeks. So at the end of 4 to 6 weeks, I could say that the woman is kind of ready for a physical intimacy. So they could start with small steps. They could probably start with more emotional bonding and support, and then get physical, which would make it pleasurable. After a childbirth, there could be perineal tears. There could be tear in the vagina, or episiotomy tear could be there. Sometimes the uterus itself kind of descends down post-delivery also. And all this can cause and the hormonal imbalances that happens post-delivery can cause some amount of vaginal dryness, or even sometimes that sagginess can be there, that loosened tear could be painful, and all this takes time to heal. So what we advise is, we advise pelvic floor exercises called Kegel's exercises, where they have to tighten the muscles of the lower part, and they have to do this about 10 to 20 times a day, where they have to tighten the muscles and relax it, tighten the muscles and relax. So this is the Kegel's exercise, which is advised for the pregnant woman as well as post-delivery. And because of the descent of the vagina or the tear, there could be a reduced support to the bladder or the urethra, which can cause leaking or urinary incontinence, which we call it as stress urinary incontinence. Based on what has caused this stress urinary incontinence and the grade of incontinence, there are several treatments for it. Best is Kegels exercises, which will during pregnancy and postpartum helps to a very large extent to prevent this urinary incontinence. But of course now we have these lasers which have come in, which can help in giving that good support to the urethra where this incontinence could be treated. The milder forms of incontinence can definitely be treated with laser techniques that we use, and it would be a repeated session laser techniques, but definitely that helps women. And I see that majority of them have this incontinence, but they accept it as a part of postpartum or the post delivery, and they don't approach the doctors for a remedy for it. But it need not always end in surgery. We could try a more conservative method, as in laser methods could be tried for incontinence. Vaginal dryness post delivery is mainly because of the hormones. So there are, when you're feeding the baby, there are certain hormones that are produced in your body, and there are certain hormonal imbalances that happen, and it takes time for it to recover and become normal. So in that case, there is lack of interest in intimacy. So that itself can cause reduced lubrication postpartum. So cause the pain because of vaginal dryness during intimacy could be handled with use of lubrication, or even starting initially with cuddling or kissing, or a small gestures like that could actually make the woman more comfortable for sexual intimacy. And waiting for the right time and having a good family support also will ease the emotional burden of the woman and would make the sexual intimacy a pleasurable one.